Atrial fibrillation can affect everyone, including young adults, and your lifestyle habits could be bringing on more symptoms.
Channel 5's Cecilia Gutierrez tells us what Afib is and how it can affect anyone at any age.
It's the most common abnormal heart rhythm, but you might not even know you have it.
It's associated with an increased risk of death, of heart failure, of hospitalizations, and of thromboembolic events, so strokes.
We're talking atrial fibrillation.
It's characterized by an abnormal electrical activity in the top chamber of the heart, the left atrium.
It's common in the United States, mainly in people over the age of 60, but it can also be found in young adults.
It's something called lone AFib if it occurs in the absence of structural heart disease, but especially here, we need to look for things like sleep apnea, obesity, hypertension, chronic kidney disease. All those things can predispose you to have it even at a younger age.
Carlos Giraldo, interventional cardiologist with South Texas Health System Clinics, says up to 30% of people can be asymptomatic. But what should you look out for symptom-wise?
For the most part, it's shortness of breath, it's palpitations, maybe dizziness. If it gets really bad, people can pass out from it. Sometimes if the heart rate's uncontrolled, there's other factors. You can get chest pain.
There are several risk factors that could lead to AFib in young adults.
In my experience, because of the obesity, the increased sleep apnea, the diabetes, the younger people with hypertension, those are enough risk factors to kind of create it.
Alcohol can also play a major role in causing AFib in a younger patient. Giraldo says 60% of binge drinkers are at risk, and it can affect your exercise routine if left untreated.
And if your heart rate gets too fast, if it's unregulated, you're not going to get enough blood flow. So heart rate, cardiac output is heart rate times stroke volume. So if your heart doesn't have time to fill and it's going too fast, you're not going to have enough blood going to the brain. You may pass out, you may get chest pain.
Dr. Giraldo says this condition can be managed through antiarrhythmics, which are medications that maintain the heart in a normal rhythm, and rate control medications to make sure the heart doesn't beat too fast.
It depends on kind of what's the cause. So it needs an evaluation as far as, is it related to structural heart disease? Is it related to, thyroid dysfunction, hyperthyroidism, hypothyroidism? Is there a weak heart causing it? So once we kind of figure out what the cause is.
He says they have to look at all the factors for treatment, and every individual case is different. But don't ignore the signs of atrial fibrillation, even if you're a young adult. Dr. Giraldo says if you feel something is wrong, to get a checkup with your physician. Cecilia Gutierrez, Channel 5 News.